That's my 72-hour healthcare story. Here's what I learned. Not all Epic implementations are the same. Training is critical. I'd forgotten how valuable the experience of walking in the patient's shoes is. And as a CIO, I got the chance to experience things that as a civilian, if you will, I don't get to experience as much. And I welcome that. It was, again, it was great experience for me. I will really drive this point home. Interoperability should have the patient as the locus of data and as the locus of movement of that data. And my point on this is always the patient is the only constant at the point of care. Epic isn't, Cerner isn't, Meditech isn't. Each point of care could have a different EHR. Each point of care could have a different physician. Each point of care, you name it. The only constant at the point of care is the patient. I think the patient needs to be the locus of the data movement. Other thing I learned, duplicate tests are prevalent. Clinicians need to listen to the caregiver, a primary caregiver, when they make requests. And one of my personal parts of my personal mission statement is that healthcare suffers because health IT is lagging. It isn't the only reason for sure, but it is a primary contributing reason for duplicate tests, poor experience, and lack of information at the point of care. Let me tell you how my father-in-law's visit could have gone with patient-centric interoperability. I want to explain this as it could have gone, so I hopefully will do it as clearly as I can. So record firmly in hand, in the Apple Cloud or wherever it is, on his phone, he presents. We pull out his or primary caregiver, my wife's phone, and which will have the record on it, and we select a handful of things: emergency, a few parameters, how long they can have the record, how they can use the record, and it generates a barcode. I present that barcode to the hospital we're checking in at, and they scan it, and the record goes into their EHR. They view and add to the record during the visit. When it is determined the transfer is required, they download it back to the patient's phone or cloud solution, whatever it is. They keep the information as required. I understand they have to do billing. They have to have legal review capabilities, maybe an archive of some kind, and they have to be able to do some training and stuff off of it. So we can grant them the rights to use those things, but nothing else. There's no other way they can use the data except what is dictated by the patient. So then my wife presents at the Cerner shop. She pulls out her phone, makes the same selections, presents the barcode. Even though it's a Cerner shop, they inherit all the information, including the chest x-ray, which can automatically go into the workflow from the previous location. My father-in-law gets the sleep that he needs because the questions have already been asked. They just need to verify them. He gets discharged. The entire record comes down to his phone. We move to Florida in 2 weeks, which we are, and the next health system picks up where the last one left off.